Hi everyone, I'm here today to talk about a test that I feel is really important whenever there is any depression or mood symptoms going on. So there's a lot of discussion these days about the topic of inflammation, chronic, low-grade, persistent inflammation that has an impact on our cardiovascular system, our joints, and our brain. For example, if you experience pain when you put your hand on a burner and you're burning your hand, you're going to move your hand away from the burner because that's the source of the pain or the inflammation. However, our brain does not have pain receptors in the same way. So one hypothesis is that how we experience inflammation in the brain is through mood changes such as depression. The blood test that I test in mostly all of my patients, especially those with any kinds of inflammatory symptoms or mood concerns, is something called C-reactive protein, also known as CRP. This particular blood test is under investigation as being a surrogate marker for depression. Also known as C-reactive protein is commonly elevated in patients with depression. C-reactive protein is commonly elevated with patients in depression, along with other markers known as interleukin-6 and TNF-alpha. All of those together are quite inflammatory. Of note is that a few antidepressants have been shown to have anti-inflammatory effects, and it has been queried if that is why they are effective, not because they are altering serotonin levels, but because they are actually impacting inflammation levels. Now you're probably wondering, what is CRP? What is C-reactive protein? It is known as an acute phase reactant. So whenever there is an injury, our livers produce large amounts of C-reactive protein and release it into our bloodstream. As a naturopathic doctor, my training allows for me to be able to offer an inflammation-reducing approach in addition to medications. This inflammation-reducing approach focuses on the whole body, reducing inflammation. So commonly when we reduce inflammation, that we'll see, improvements in joint pain, reductions in other types of pain symptoms, maybe headaches, chronic muscle and joint pain. A few things that have been shown clinically in studies to see what improves C-reactive protein are actually omega-3 fatty acids and as well as curcumin, also known as turmeric. Both of which, curcumin and omega-3s, have a couple of studies on each of them showing improvements in patients who have symptoms of depression. In addition, other things that are anti-inflammatory that I work on would be things like your digestive health. So how many bowel movements are you having a day? Do you have chronic digestive concerns such as IBS? Improving diet, of course, reducing processed food, increasing vegetables, and then achieving adequate movement are all really important to reducing inflammation. Quality around herbs and supplements is important, and just a reminder as always that this video is meant to be educational only, and I'm not providing or recommending anything to you. You'll need to speak with your family doctor or naturopathic doctor to find out what's an appropriate treatment for you, because I don't know your specific health history. And that's my video for today on C-reactive protein, which is the blood test that if you are on antidepressants or you have depression symptoms, you should probably speak with your doctor about getting that investigated, as it could help shape your treatment plan by focusing things to be more anti-inflammatory. Hope this was helpful. Enjoy the rest of your day.